Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. It has been a minute since I've done the ABCs of concussion. I've been putting it off because I had some really excellent interviews that kept coming up, and I kept wanting to get them out. And I realized it's been a while since I've done an ABCs of concussion, so it's time to bring it back. So again, for those of you that are just tuning into the show now, I've been doing this series called ABCs of concussion and taking every letter of the alphabet and talking about things that are related to concussion, whether you are a person that's had a concussion and you have some of these problems afterwards, or if you have some of these problems, you don't know why you have them. And we've talked about how if you're that latter person, you have all these symptoms and you don't know why you have them, maybe think about when in your life these things started and look back to see, did I have any kind of injury or anything like that prior to that may explain why I have these symptoms? So that might be a good explanation for why you have these problems to begin with. So if you're either one of those, this is a great series to listen to. So if you're just tuning in now, do go back because I've covered everything from letters A all the way through I previously. Today is going to be letters J and K because I couldn't come up with a ton of letters or words for each letter individually. So this is going to be a twofer today. And kind of before we get started on that, I do want to remind you that if you like what you're hearing on the show, I do have a way that you can support me. Not a lot that I do for right now for fundraising or financing of this show. I do all of my own stunts. So if you love what you hear and you want to be able to help support me any way you can, if you look in the show notes, there's an option to buy me a coffee. And no, you're not actually buying me a coffee because I don't really drink a lot of coffee, but you are buying me a virtual coffee essentially. So you can choose any amount to support the show. So whatever amount feels comfortable to you, feel free to find that link in the show notes and give me a little shout and let me know that you're listening. Let me know that you love what you're hearing. And also, alongside of that, if you do have topic suggestions, speaker suggestions, letters of the alphabet, that words you think I should include in upcoming episodes, please do leave a comment on the show or send me a message. You can do that any of those ways. And I do love seeing all of the listeners, how many listeners there are, and the list just keeps growing. I can't believe we are into the 140-something episode. I lost track of where I am, but we're up there. So we have a ton of episodes. And again, if you're just joining now, please do go back because I've had some really amazing guests on the show in the last couple of years, and I still could use a little bit more support. So if you like what you hear, subscribe, do all the liking, share, comment, do things that pop it up for other people to listen, because that's how I increase my listenership. I don't do a lot of publishing. I don't market. I try to market, but I don't pay for marketing if you catch what I'm saying there. So it's all word of mouth. So the more you can do to help support the show, the better, because everybody needs to hear this information. As I was practicing this new recording thing that I'm using, I'm trying to see if I want to switch from Zoom to a new platform. And it had me go through some test questions to see how I do. And one of the questions is, who do you want to listen to your show? And I want everyone to listen. I do try to make this as easily listenable to anyone, whether you are a provider or a non-medical person, that you can get something out of this show regardless of what your status is in life. So there we go. So without further ado, let's get into today's letters. Letters J and K, again, is what we're doing for the ABCs of concussion. So the first J letter I have is judgment. And this one can have multiple meanings. This judgment is something that is easily passed on to someone who has had a brain injury for multiple reasons. Again, as we've talked about so many times, brain injury is an invisible disability, though sometimes it can be assumed that the person has nothing wrong with them and that they're just being an a-hole or a jerk or whatever you want to say. People can make mistakes due to misunderstanding what's going on around them or not remembering. So those things like misunderstandings and not remembering things may be perceived as the person being careless, reckless, not paying attention, not caring. So all of those things can happen to the person, so they feel judged or they are judged by those around them. The person with the individual with the injury might be perceived as lazy or attention-seeking or not wanting to work, especially if the injury was a work comp type of thing. So I do see that there are some judgments that I've seen in my colleagues that they judge some of those patients and, they just don't want to work, so they're going to do whatever they can to not get back to work. And it's not seemed to be the case of most of the patients that I see, nor was it my case. I would have done anything to get back to work sooner than I did. And I know several of my patients that have come in and they get very emotional when they talk about the fact that they can't get back to work and they can't get the accommodations that they need because they really miss being at work. So it's not that these individuals are lazy. They just can't get better as fast as they want to, and we need to give them a little bit of grace. And there are some judgments that people might think that the person with the injury, is dwelling too much on their injury. They talk about their injury too much. Yet you would never tell someone with cancer to just get over it. And so I think that we kind of have brain injury in that same category as mental health, where people just assume that you're fine. They assume that you don't want to do things, and they will tell you to get over it. And it's not really a problem. You shall pass. I have a tattoo that says that, but still, like, you're not going to say that to somebody that has cancer. So why would you say that to somebody that has a brain injury? So regardless of the fact that it is an invisible disability, we still need to give people the benefit of the doubt because, again, most of these people are not lazy, trying to just work the system. They had an injury, their brain is trying to heal, and we need to help them. The judgment also can be affected in the individual that has an injury. Judgment tends to be in the front part of our brain, more so on the right side of our brain. So if we end up with injuries in that frontal lobe, so if somebody hits their head on the front, or vice versa, they hit their head on the back, and now we have the contracture injury on the front, you're still getting an injury to the front of the brain. So frontal lobe damage can affect your personality and create lack of insight and poor judgment. So people might take unnecessary risks. They might not realize they have deficits, and they might end up with subsequent head injuries because of it. Or they might turn to substance abuse because that judgment is poor. They can't really judge right from wrong. They can't really tell if they're overdoing something. And that can be as simple as just not judging when you need to take breaks. So as the person with the injuries, you're trying to heal, you need to be able to take a step back from activities at times and say, you know what, I need a pause, I need a break. But that judgment might be missing. So you might misjudge that need for taking a break or that need to take a step away from what's going on because you're getting overstimulated or overwhelmed. But that judgment can be just as simple as that. It doesn't have to be as big as taking unnecessary risks, but just judging when you should or shouldn't do something, when your limitations might prevent you from doing something safely. All of that can come into play as well. How do we manage the second type of judgment type of things? Cognitive therapy, speech therapy, occupational therapy, both can do some different parts of cognitive therapy. Neuropsych can also do some evaluations and some therapy with that. So there's a lot of different ways that we can try to counsel when we have that lack of judgment to help teach individuals to regain some of that control and regain some of that judgment so they see a little bit more of what's going on and learn to have some of that insight that has been lost. The next topic I want to talk about, next J topic, is jaw. And this is one that I think gets overlooked quite a bit. There is a lot of research about it, but there's not a lot of talk about it. So when people come in for evaluation, they'll say their jaw hurts, whatever, and it kind of gets overlooked because maybe the x-ray, the head CT didn't show any kind of displacement of the jaw or fracture of the jaw, so people just kind of put it off. But according to a recent paper published in Facial Plastic Surgery, which is a publication of the Journal of American Medical Association, this paper identified that 75% of patients with mandibular fractures, jaw fractures, were found to have concussion. So if you think about it, it takes a substantial amount of force to break someone's jaw. So when you have that much force on the head, your brain is right in there, chances are you're going to get a concussion from that too, because that's a lot of pressure, that's a lot of force required to break that jaw. The jaw is meant to provide protection and work together with the skull to protect your brain. So when that jaw breaks, that again required a lot of pressure, we can end up with a concussion there too. As this article showed, 5% of patients with those mandibular fractures also had a concussion. We often see this as a result of assaults or motor vehicle accidents. And sometimes just the musculature can cause problems with the jaw as well from that motor vehicle accident. Kind of think of that whiplash. It affects everything from around the neck and the base of the skull into the jaw. There was a 2021 literature review that looked at multiple articles that have been published on maxillofacial surgery and temporomandibular disease, TMJ being one of them, temporomandibular joint disorders. My mouth is not working with me today. Sorry, guys. So this 2021 literature review was published in Advances in Oral and Maxillofacial Surgery. In that, they cited that one of the studies they found identified 24.5% of patients that had TMD, temporomandibular disease, were associated with a history of trauma. So a quarter of those had a history of trauma. So we already talked about 75% of the patients with jaw fractures have concussion, but 25% of patients overall with temporomandibular disease had a history of trauma. So that's a huge amount. Jaw pain can be associated with these TMJ disorders. It can be from rapid head movements. So again, as we talked about, the whiplash movements, muscle tension that comes after the whiplash, and we see all the pain related to that. That can further exacerbate that because those muscles are all connected to our jaw muscles as well. We can see patients ending up with chronic headaches, chronic facial pain, neck discomfort. Any of those things can happen, and those should be signals to us that maybe we need to think about the jaw in connection with their concussion. So again, some of the other symptoms that we see: tenderness in the face, jaw, neck, shoulders, any of that area. Ear popping or ringing in the ears can also be related. Clicking or popping sound in the jaw, I think that's what typically people most think of with TMJ. Difficulty or pain with chewing, swelling on one side of your face, locked jaw where you literally lose some of that jaw mobility, headaches, dizziness. Again, some of these symptoms kind of coincide with so many other things with concussion, but it makes us think that we need to address the jaw at least. Talk about it, ask questions related to it. As a provider, ask some of these different things, because sometimes patients don't think to tell us. They don't always realize that some of these things might be related. So they might not think to bring it up when they're in an appointment talking about their concussion. So we need to get good at asking some of these things so that we can treat it. So how do you manage this jaw issue? Initially, probably avoiding hard foods and eating a soft diet, but you're not going to want to sustain that long term. Over-the-counter pain relievers can be helpful: ibuprofen, acetaminophen, ice packs. Initially, you don't want to use ice packs long term. And I will stop for a moment and talk about that, because we used to talk about inflammation. If somebody was injured, we talked about RICE, right? Rest, ice, compression, elevation. That's an acute type of thing. So acute injuries that happen just now, ice is helpful. When we use ice more than after a few days after that acute injury, can actually slow the healing process down. So we don't want to use ice packs on the jaw or neck long term, but using them in the short term will be potentially helpful for relieving some of that pain. Relaxation techniques, because it's about how the tension in the neck and jaw can make things worse. Relaxing that jaw can really be helpful. Physical therapy, whether it be manual therapy or exercises that they give you specifically for the TMJ. Sometimes people need injections into the jaw area. Sometimes people need to sleep with a mouth guard at night. A dental or orthodontic evaluation would be very important as part of this whole process. And then there will be some individuals that may go on to need surgery to repair a jaw fracture or dislocation or something that we need to get past that. So lots of things with the jaw, lots of things to think about that we probably didn't think about before. So an interesting topic to cover, but I've been seeing it more and more as I'm working in clinic. The next one's kind of a little bit interesting. The next one is jail. So when we're talking about people that are incarcerated, whether they are in correctional or detention facilities, the CDC actually has a really good set of information on their website about people that go to jail, their history of trauma. So according to all of that research they have on their website, almost half of all adults and about 1 in 3 juveniles that are in correctional and detention facilities have had a history of TBI. So that's a lot of individuals to end up in the correctional facilities, in the correctional system, with the history of TBI. Why is that? I'll talk about that in just a minute. Intimate partner violence related TBIs are common in females that are in correctional and detention facilities. And there are links to other mental health issues with individuals that have a brain injury and end up in the detention institutions with mental health problems, substance use disorders, impulsive behavior, difficulty controlling anger, self-harm, suicidal thoughts, and then obviously problems with thinking and behavior. We've talked about that with concussion a lot. And that's what some of the things are that lead to people having lack of judgment, problems with their behaviors because they don't understand right from wrong anymore. And now they end up in the justice system. Those that are in correctional facilities may have more challenges accessing TBI-specific care and then adhering to those treatment programs, again, because of all the behavior issues that can show up with that. There are higher rates of recidivism, meaning these people return back to corrections after they're released, and there's a greater need for crisis intervention services for individuals that have a TBI history versus those without TBI history. So those TBI symptoms also can increase their chance of needing disciplinary action while they're in the correctional facility, again, because of those behavioral changes and mental health issues that can come up with that. What are some things that we can do for this? There is very limited routine screening currently done with individuals in correctional facilities. So I think a lot of it can be done at the correctional facility level. Increasing awareness among the correctional staff would help this. The screening and providing services to these individuals would definitely help them and maybe decrease the chance of that recidivism afterwards. And coordination with the probation services for follow-up screenings and treatments after people are released from correctional facilities, again, to try to reduce that risk of them returning right away. And then there are some state programs that have services in place, but not all. So the CDC website has a list of some examples of a few states that do have these services. So if you are in a state that doesn't have these services, maybe take a look at their website and see what other programs are doing to see what you can do for improvement in your own system. So the next J letter is jealousy. Jealousy and envy show up especially in relation to comparing your own healing process to someone else's. The expectations about your recovery may not line up with your own recovery, and that can lead to a lot of frustration when you see other people still carrying on with normal life. That can lead to a lot of jealousy. So you can be jealous of the people that are going on with life as usual. You can be jealous of how quickly somebody else is recovering and you are not. You can be jealous of the things other people are complaining about. And that was one thing that I experienced when I had friends complaining about, oh, I have to go to work again today and I wish I didn't have to go to work. Or you'd see the memes come across and people were finding any reason whatsoever not to go to work. And all I wanted to do was get better and go to work. And it frustrated me to know and to watch these people complain about things that I wished I could do. And I think that kind of puts things in perspective for all of us, maybe a little bit, that what we are complaining about, somebody else wishes they could do. So that jealousy can definitely come to rear its ugly head. That little green monster comes out. So relationships can be impacted, as we've talked about on this show previously as well. And that can lead to jealousy or resentment because your partner or your spouse is still going out and doing things and you're not able to do those same things. And that can cause a rift in the relationship amongst all of the other things we've already talked about with the relationship issues as well. How do we manage jealousy in that recovery? First thing you need to do is really try to focus on your own recovery and really not worry about what anybody else is doing. It's always really hard. That whole grass is always greener on the other side of the fence thing is always going to be there. And you're always going to maybe watch other people and see what they're doing, but you can't judge yourself compared to what they're doing because no two concussions recover the same. And I can say that with 100% confidence because having my own concussion and now working in concussion clinic on a regular basis, that's all I do is see concussion patients. No two people recover the same. So while there are similarities, and as I talk about all these ABCs of concussion, yes, some of these things run similar between different people. There will be no two individuals that will sit next to each other, have the same concussion, and have the same outcome. It just doesn't happen. So you have to be able to focus on your own individual journey. Compare yourself to what you were yesterday, not what you were before the accident. Compare yourself to what you were yesterday and see, am I better than I was yesterday? Not, am I better than Joe Schmo down the road who had a concussion, because he might be different and he might have a different recovery. He might have other different comorbidities that makes it different, or lack of comorbidities if you're the one with other things going on. But just focus on yourself, your own recovery. Along that line, practice mindfulness. And this seems like such a simple thing to do. And every time we talk about it, I kind of want to giggle a little bit. I'm like, what good is mindfulness going to do? But there has been so much research to show that mindfulness can help you heal. It can help kind of fix some of those things that you have from any kind of trauma situation, but a traumatic brain injury especially. You need that time to focus on yourself, focus on breathing, focus on trying to heal, calming your brain so that you can heal. So mindfulness seems like a really simple thing to do, but it's not easy. It's one of those simple but not easy things. So thoughts on that one? Whether you like it or not, it's really good for you. And then seek support. Again, we've talked about support groups many times in the different alphabet letters here. Seeking support is really important because if you join a support group, you're going to be among other people who've been there. They understand. So if your family, if your close friends aren't really understanding, people in a support group probably will because they've been there. Communication. I've talked about this with so many different topics, with so many different guests on the show. Communication is key to any good relationship, and we often underestimate the importance of communication. So when you're communicating with your spouse about how it might frustrate you that they're continuing to go about doing things and you can't, maybe you can find a way to find a happy medium there. Or with your friends, if you still really want to get together with your friends, but you can't do that big, busy bar scene, see if they're willing to come over, just have a couple people hang out for a little bit. Communicate your needs so that you can still get through those things and you don't have to have that FOMO kicking in, that fear of missing out there. And then be kind to yourself. This probably could have been a K letter all on its own, but that being kind to yourself is really, really important. To have the same grace for yourself that you would for somebody else. So be kind to yourself. Try to hold on to that. And then seek professional help if you need it. Counseling can be really, really helpful to get through some of these things, to talk to somebody who is a neutral third party, and they can help you identify whether or not your feelings are correct for that setting. They're always correct because your feelings are always your feelings. But are they correct for their setting, or can you maybe adjust how you're responding to different situations so that you're not feeling so much frustration there? So lots of things to go on. Jealousy is a big one. It happens to a lot of people. That little green monster comes out a lot. So see what you can do to overcome that a little bit. Tame it down. The next one is justice. So we talked about the jail system. We've talked about so many other things with concussion, but justice, again, is kind of an interesting one because if somebody else caused your concussion, such as with a car accident or an assault, you may feel the need or want to pursue legal action to cover medical expenses, lost wages, pain and suffering, close that loop on that healing process because you just feel like justice needs to be served in this case because you are left with this concussion, possibly post-concussion syndrome affecting you. All of these things can happen and you're left confused and frustrated and maybe not able to work and not able to do the things that you did before. So seeking that legal action can be a really important thing. So how do you do that? There are specific concussion attorneys that might be a little bit more helpful than just your regular attorney because they've had experience, they know where to go, they know what kind of resources might need to be enacted, they might need to know what kind of experts they need to get involved so that you can get the best settlement possible. So with that, you're going to need to have some good documentation. And documentation is important for anything you're doing in concussion. It helps you remember your own things so that you know what you're doing on a regular basis. But it also is really important anytime you're thinking legal action, anything like that, you have to have all your ducks in a row. Get your I's dotted, your T's crossed. I always flip those two around, but get your I's dotted and your T's crossed. Make sure you have all your documentation for timeline. What happened? What was going on? Where did you go? Where did you go get care? Get your medical records so that they can show what has happened with your injury. You might need to have additional testing done. Some people need to get neuropsych testing done if they haven't already, so that they have evidence that there is cognitive deficits. And then you can either negotiate a settlement or proceed with a lawsuit, proceed to court, depending on how the case moves forward. But your lawyer will help you with all of that. And then the settlement values themselves are determined by a multitude of factors. The severity of your injury. And as we've talked about on the show before, when you get that diagnosis of mild, moderate, severe, that is just the injury that happens at this moment. What happened at the moment? Did you have loss of consciousness? Did you not have loss of consciousness? Was there a skull fracture, any bleed inside the head? That helps to determine the severity level of the injury itself. It does not look at the severity of the symptoms that are ongoing. So if somebody has post-concussion syndrome, they had a, quote, mild concussion, but this continues to go on to cause lots and lots of problems for them. It's no longer a mild TBI at that point when you have these significant symptoms. It might be mild in terms of what happened at the initial diagnosis, but now it's a moderate or severe injury that's leaving you with these debilitating symptoms that's going to change your life, and that needs to be taken into account when you're looking at this settlement. So you need to look at your medical and your long-term care needs. And sometimes there is an expert that needs to come in to help figure out what those needs are going to look like. And as I was studying for my brain injury certification exam, I learned that there are actually specialists like that out there. That's all they do is try to help advocate for and calculate what those needs are. So your lawyer will enact the assistance of that expert so that you can get that good information calculated. Your ability to work will determine the settlement as well. So you need to consider lost income. And that means maybe you're not able to return to work at your job before. So what's that lost income from that? Maybe you're not able to return to any kind of work. So you have a complete loss of income. So all of that will need to be taken into consideration as well. And then pain and suffering. This is a term that kind of gets thrown around anytime somebody's talking about any kind of legal action. What is that pain and suffering? In this case, it's related to personality changes, social challenges, loss of friendships, that inability to perform or even enjoy the hobbies that you do. It's hard to put a dollar amount on that, but that's also something that needs to be considered when you're looking at that settlement. And then liability issues. Some states will proportionally reduce or completely eliminate compensation if you were partially at fault. So that will definitely come into play. And then gross negligence. So if the other person was completely reckless or there was malicious intent, that may add punitive damages onto the case as well. And then there are potential insurance policy limits. And I think anybody that's had to deal with an insurance company will identify that those insurance policy limits will put a damper on what can be done. So definitely something to consider when you're looking at that settlement amount, what should be there. The Brain Injury Association of America published a really good article on their website about all of this and looking at the things to take into account, how to find a lawyer that can be good for you. They do warn against settling too soon and list a number of reasons why, including the fact that brain injuries are hard to diagnose. So trying to diagnose that, and sometimes there are legal cases that they will say, give me proof that you had a head injury. And I have a couple of patients in my practice that have legal action because of incidents they were involved in. And one of them particularly needed additional documentation and additional imaging that we didn't have capability for. So I had to look around and find, and there is one facility in the state of Minnesota that can get the image that she needed for her legal case. So I had to put that referral through. I had to call and figure out how to even put that referral through to get her that image that she needed because her lawyer needed it to prove that she had a head injury. So that image is a SPECT image, and Mayo apparently is the only system in Minnesota that has the specific type of SPECT imaging that can look at the brain. We've talked about SPECT imaging before when I had, I guess, Dr. Schaller on the show a few months back now. And I'm setting up some work with Amen Clinic to get more information about the SPECT scanning through them as well. Closest to Minnesota is Chicago. So that's the next place that I could send somebody to get this image done. So we'll see what comes back from this Mayo image. I'm hopeful that it's going to be similar to the test done through Amen so that we can get some really good imaging. And because those images, I've seen the results, those are really, really cool. So side note on that one. And then another reason why you don't want to settle too soon is that you might not fully understand the extent of your injuries. So you might be optimistically thinking that you'll recover faster than you actually do. I don't know anybody else who may have done that. I totally thought I was going to get better faster than I did. But so you might be optimistically thinking that you're going to recover faster. So again, you need to get that specialist in to look at what your future needs might be so you make sure that you get the appropriate amount in your settlement. And then insurance companies, I don't know if you knew this, but they don't have your best interest at heart all the time. So their first offer is usually going to be less than what the case is worth. So don't take that first offer. You need to evaluate and make sure, is it a good offer? And the thing to remember in all of this is that settlements are final. Once you settle, once you sign all the paperwork, you permanently give up rights to go back and file for anything else on that. So there's no do-over if you miscalculated anything. So really make sure that you fully understand the extent of your injuries, that you get the diagnosis that you need, that you work with that first offer, maybe not take that one because it might not be the best one for you. And then just think about those carefully. Again, if you have a good lawyer, they should really be helping you out to get the best settlement possible. The Brain Injury Association of America does have a list of preferred attorneys for each state that have experience dealing with TBI cases. You don't have to use them, but it's a great starting point so you know where to look. And then again, as we kind of talked about at the beginning of this letter, completing that legal case might help close a door for that part of your injury so that you can move past that and find the next thing you need to work on for your healing. And that's what I have for the letter J. I have a couple letters for K that we'll go through, a couple words for the letter K, I guess I should say. The first one being kids. And kids is another way to say children, unless you're talking about goats. Kids is another way to say children. Covered children issues a little bit back in the letter C. I'll probably touch on it again when we get down to the letter P for pediatrics. But when we're looking at these, some newer information, I think, since I did the letter C episode is that 50% of sports-related concussions that are seen in the emergency departments are in ages 17 and under. So this is not all concussions, but those that are seen in the emergency rooms. When somebody gets an injury, they go to the ER to get evaluated, they're identified that they have a concussion. Half of those are 17 and younger, meaning kids, pediatrics, children, all of that. So we often think that kids are made of rubber and that they bounce back quickly. They're shorter, they don't have as far to fall. But even though kids look like they're, quote, just fine, they might have difficulties later. Just like we've talked about this in adults as well, but kids also, they might have difficulties later and we might not put those two things together anymore. So they can develop ADHD, they can develop learning difficulties, behavior issues, and depending on where they are in their growth periods, that can have a major impact on how their brain develops, leading to some of those cognitive issues. And these difficulties are usually diagnosed later on as individual problems. They're not really linked to the concussion. In my brain injury course that I was taking, there was another individual in there that said they had a student in their school who developed behavior issues, and they were trying to do an investigation and figure out what was going on. Come to find out that when the child was like 2 or 3 years old, fell from a 3-story building or something like that. I can't remember all the details from it. It was not my case. It was their case that they were sharing. But nobody had really thought about that because they never said concussion at the time. They were worried about any other injuries, but they weren't really worried about concussion. And at 2 or 3, the child looked fine. But later on when they're in school, that's when they realized, oh, hey, now we're having difficulties learning. And it's probably not a problem all by itself, but it very well could be related to that injury when the child was 2 or 3. So it's really important to think about what happened previously and watch for things to happen in the future. We know better now, so we should be doing better and monitoring for that and educating families on this might happen down the road. If it does, come back, we'll reevaluate, but those things are not happening. So we need to be aware of those things. Kids can also be affected by a parent who sustains a concussion. I had one of my patients ask me if anything could be genetic, essentially, if they could have passed anything down because they'd already had a brain injury. Nope, but the difficulties that you're having from your concussion can cause problems with your relationship with your child. So as we've talked about previously, again, head injury can affect any kind of relationship, and it can affect how you communicate with others. It can affect how you perceive things around you. So it's not uncommon for those concussed parents to have a short temper, get upset easier. They can take some of that frustration and anger out on their kids by raising their voice more than they previously would have, disciplining the kids more strictly or unnecessarily in some kids, and not understanding their kids' behavior when they're just being kids. So that can lead to a lot of relationship strain between the concussed parent and the child. And kids can have PTSD from witnessing the traumatic event that caused a parent's TBI, whether it is domestic partner violence, whether it's a motor vehicle accident, whatever it was. If they witnessed their parent sustaining that injury, that can cause PTSD for the kids, and they might need some therapy for that. The other thing to keep in mind is that if the motor vehicle accident caused a TBI for one person in the vehicle, such as the parent, really we should be screening everybody in that vehicle for potential head injury. And I had the opposite way around. One of my patients had their grandchild in the car, and the child had the head injury, and then nobody ever really talked about head injury in the grandparent. But guess what? She did too. So we really need to get better about screening everybody in the vehicle for a concussion if somebody in the vehicle had one, because chances are more than one person in that car sustained an injury. So if that parent was diagnosed with a TBI and they have the child in the seat in the car, not only can the child end up with PTSD from the event, but they also might have a head injury too. So kids might benefit from counseling for any or all of these reasons, all of the above. And then my last letter for you today is knowledge. Silent K. So knowledge is power in so many cases. And this is the whole reason I'm doing this series, is to increase knowledge about the injury. So we need to educate the public, healthcare workers, coaches, teachers, basically anyone who interacts with other human beings, because we need to be able to have compassion for those other human beings. And if you're in a leadership position, you have to be able to identify that somebody's had a concussion and help them get the care that they need, get them out of this situation that they're in. And then again, knowledge is power. Now that we know more about concussions, we really need to do better than we did in the past. And in so many ways we are. There's so much research happening all the time on things that we can do better with concussion. We previously didn't know that so many individuals continue to have symptoms. Now we know that 30+% continue to have symptoms greater than a year. We didn't know that cumulative concussions led to long-term consequences. Now we know about second impact syndrome and CTE and other memory issues that come about. We didn't know that you could sustain a concussion without hitting your head or losing consciousness. And now we know that only about 10% lose consciousness, and only about half of people actually hit their head. So there are multiple other ways that you can end up with a concussion other than hitting your head, and you don't have to lose consciousness. We didn't know that there were so many treatment options, and I have identified so many on this show, whether it's in this ABCs of concussion or with different guests that I've had on, and there's really no limit for improvement. Again, we used to say between 6 and 12 months, whatever you got back, that was it. We said the same thing about stroke, and that wasn't true either. So I have seen people years after their injuries still getting better when we initiate new treatments. And again, so I'll say it again and again and again. Once you hit a plateau, it's time to try something new, because you need to spark the brain in a different way to get it going again. Schools can do better by identifying if someone is having difficulties following an injury. Do some research, like the case that I shared from one of the people in my brain injury course. They're doing the research to try to figure out what's causing the child to have behavior issues. We need to do better. So figure out what's going on, see if we can investigate and find out, was there a brain injury related to this? Is there something else going on? Coaches can do better overall at keeping concussed individuals out of play. Historically, we would just kind of ask the players, are you okay? Get them back out there if they didn't lose consciousness, or even if they regain consciousness right away. There's a lot of stigma about staying out of the game, but there really should be a lot of stigma about getting permanent brain injury. So we can do better. It's getting better, but they're not all created equal as of yet. Healthcare providers can do better by identifying concussions. better. So asking all the questions, looking at treatments earlier rather than saying, well, let's wait it out and see how you do. Because if we wait it out and see how they do, people might not regain all of that function. We need to educate about all the things that can go on with a concussion. As I'm going through a review of systems, I ask about every single potential body system because guess what? Your brain is connected to everything. You can't just say, hey, yeah, we have a brain injury. We're going to deal with brain things because your brain is attached to everything. It can affect your hormones. It can affect your metabolism, and it can affect your balance, your vision, your hearing, your taste, your menstrual periods, your sexual desire. It can affect all of these different things. We need to ask about them. If we're not asking about them, we're not going to find out. We can't treat it if we don't find out. So we need to screen for all of those other issues. We need to ask all the questions. And people look at me funny when I'm asking all those questions, but guess what? They're related and they're things that we can deal with. So I don't know if anybody here is the same age as me or older. If you remember that little TV PSA announcement back in the 90s, the more you know, that little rainbow and the star. This is more than just a little rainbow and star, the more you know type of thing. It's a way of life for me now. I am on a mission to increase knowledge for anyone who will listen. Since I started this podcast, I've been talking about being on a mission to help people create healthier, happier brains. And this is no different. So trying to create the healthiest, happiest brains we can following a concussion. And then maybe we'll talk about prevention down the road, in the P letters. So lots of things that we can talk about. And if you are local to Minnesota here, especially in the Wayzata area, the fall community education book just came out with all the courses. If you look in there, Wednesday, October 8th, I think it is, of 2025 here, you'll see a course called Head Injury 101. Guess who's teaching it? Yours truly. So we'll talk about some of those prevention strategies. So if you're local, come see me in person, register to take that course through that Wayzata community education and see what you can learn about preventing injury and helping to heal your brain. Because again, that's on my mission to help heal people's brains and make healthier, happier brains. And if you like all this stuff, like, subscribe, follow, share, do all the things, comment, do anything you can to try to get more listeners because more people need to hear this information. Can't say that strongly enough. So thank you for being here today, guys. See you next time. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.